My name's Adam. I'm a psychological therapist, so if someone was to come into therapy, we'd want to offer them a space where it felt like they were listened to, understood and felt safe. And hopefully with those things, people felt they were able to talk about their problems. And then what we do is, perhaps with therapy, we're trying a bit more active and trying to think about, well, hey, what can we do? What can we try out that maybe makes that person's problems feel better? We start working with people around the age of 14. Not that we do work with many people under the age of 18, but sometimes we do. And it used to be up to 35, but recently that's been extended up to 65. So it's quite a range. And obviously through that, someone's needs are when they're 20 and they have an episode of psychosis is obviously very different to what someone is when they're 50 or 60. When we work with people, collaboration is really important. Therapy is not something that's done to someone. It's working with someone and focusing on, their problems, but also their goals in a way that it feels like they are not pushed to do things that they don't want to do. We're going in a direction they want to go and at a pace they feel comfortable at. So when we first meet someone, we will ask them questions about what their difficulties are now. What's causing them the most problem at the moment? And then maybe we'll ask a bit about their family, the upbringing, and any other kind of stresses or difficulties that are going on in their lives at the moment. Anything we need to be concerned about, harming themselves, harming anyone else, or there's anyone else at risk. That's an important part that we have to do, which is a really difficult conversation sometimes, but it is important. And by the end of that meeting, hopefully we've got a bit of an idea about the next steps. Probably we'll meet regularly, so maybe weekly. Those sessions are usually an hour, and more often than not, they'd be in somewhere, perhaps in a building like this, so in a room. And then we'd refer to probably a thing called a formulation. The formulation is our kind of shared understanding. Quite often, when I work a lot with CBT, cognitive behaviour therapy, we might draw that out on a bit of paper. So there'd be the problem, what people think about that problem, how that makes them feel, what that makes them do, what do those behaviours end up causing, consequences. And so they'd be bringing their expertise of their life, and I'll be bringing my knowledge of therapy, and between us hopefully we'd think, let's look at this today, what do you think we should work on? And we're trying to have some sort of shared collaborative idea about what we're going to work on and about how can we make ultimately that person feel better. A lot of the work we would do would be with the individual, but there's other things, there's other therapies within the service that we offer around family work, isn't it? Family interventions that would perhaps look more in depth at the family and carers around someone. CBT is the predominant therapy we offer because that's recommended by the NICE guidelines, and the NICE guidelines recommended it because it has the weight of evidence behind it that is most effective. There's lots of evidence for CBT for a variety of problems, anxiety, depression, obviously psychosis, post-traumatic stress, obsessive and compulsive difficulties, so list goes on. So it's quite a useful, it's kind of therapy to be able to offer because it can work on many different things. So as I said, CBT is probably our predominant therapy, but some of our colleagues also offer other therapies. One of the other therapies we offer is called cognitive analytical therapy, and CAT is, I would say, mostly used with emotional difficulties and difficulties in relationships, and it's looking at those repeating patterns of difficulties in relationships. So it probably works in some ways. There's some similarities and crossovers with CBT, but it's much more focused about the relationship between you and someone else, whereas CBT is probably much more focused about the processes within a single person. CAT is much more interested in the processes between people. The overarching aim of early intervention, I guess therapy fits within that, is what we call social recovery. So it's not focused on getting better symptoms, although obviously that is important. It's actually that the episode of psychosis doesn't interrupt people's lives. People getting back to those previously held social roles, so school, college, university, work, parenting, they're back in the community. So that would probably be the number one sign that someone's recovered, is they're back to doing what they were doing. And actually, while perhaps they even have some ongoing difficulties, they don't get in the way of them living the life they want to live. The classic symptoms of psychosis are having some kind of sensory experience that's not based in reality, so hearing things, seeing things, maybe feeling things, touch them, smelling things, tasting things, having very strong beliefs in things that seem very unlikely to be true. I suppose what we're really interested in doing is understanding why someone's having those experiences. Quite often we'll find that people have had really difficult life events that have left a mark on them, psychologically, emotionally, physiologically, that have caused them to then have these experiences now. Or at least we can see how those experiences in their life link into these experiences now. Some people's experience of therapy may not be the most positive. It is talking about possibly some of the most difficult experiences in their life. But I would say that most people we work with do find therapy helpful. When you're dealing with a lot of difficult experiences, someone who helps you to kind of make sense of them, it's perhaps a bit less frightening. Sometimes it is just about the opportunity just to really spend some time with one person and really get to know them and actually be really open with them in a safe way, and that feel like that's okay. That in itself can be a really positive experience for people. Therapy can be really helpful for people. It can be that thing that just then gets them back to where they want to get to. It can be that almost like the final piece of the jigsaw